And with that, I will turn it over to Tim Marshall to provide us with a bit of an overview for today's presentations and discussion, and then we'll go from there. Thank you.
Great, thank you, and good morning, everybody. I know there's some people still joining us, but so just a quick overview. This group, again, we are hoping to, first of all, we're trying to keep things very tight at 60 minutes and not go more than 60 minutes on a monthly cadence. We're hoping that we'll be able to do the majority of the work by Thanksgiving. This is our second meeting. We'll have another meeting in August for our next meeting. And we would like to continue focusing on the state's infrastructure that has been used for a couple of projects and that we are looking to potentially join and continue to build. So you'll hear from Bill Halsey from DSS on 500 Familiar Faces, and then you'll hear from Bert Plant and Beacon Health Options in the work that they did with that same project. And then we'll hear from folks from OPM and continuation on the discussion of P20 WIN and why we think that it makes sense for us as a Children's Behavioral Health Implementation Advisory Board plan as the implementation group representing 12 state agencies that we would want to join and put our support into that activity. So that's really the structure of today, and we'll turn it over and get us going with Bill Halsey from DSS. Bill?
Hi, good morning, everyone. I was asked to talk about a pretty ambitious data integration project called 500 Familiar Faces that we embarked on many months ago. Under the leadership of Lisa Tepper Bates when she was in the governor's office. This was an initiative to bring in multiple data sources from multiple state agencies to identify, per the term, the term of the project, 500 familiar faces, which I'll translate into in a different way. What we're really trying to understand is who are the individuals and potentially families that touch multiple state agencies, and within each state agency have been identified as high utilizers. So there were a couple cuts at the data. We wanted to match individuals that were involved in multiple state agencies, and so we're talking about probation, CSSD, DOC, DEMIS, DCF, DSS, the Medicaid program, and within the Homeless Management Information System. And so all of those agencies shared data with Beacon, and Beacon matched the names on a first layer cut to see how many people touch multiple state agencies. And then we asked each state agency, please develop criteria about what it would look like to classify somebody as a high utilizer. And then that was the second layer of cut. So then we were able to take that criteria and apply it to each state agency, because each state agency identified high utilizers differently. And then the second cohort were those individuals that were high utilizers across multiple state agencies. The original intent of the project was to actually develop a direct service intervention for these members. However, because of the public health emergency, we were not able to develop and implement a direct service intervention. But we are still working on that project. We are still working on data integration. We are still trying to work on a coordinating effort to better understand this population. And I think I'm supposed to hand it off maybe to Fred or Manisha on that point. But that's the general principle. We wanted to get a better sense of individuals that were touching multiple state agencies and were high utilizers within those state agencies. But we also really worked on trying to leverage data integration platforms and kind of understand the complexity of data sharing across multiple state agencies, which we would like to use as Jeff and Tim said, we want to leverage that kind of lessons learned into this project and kind of continue and advance that project forward, at least the data integration component. So I think I'm supposed to hand it back to Tim.
Yeah, it's great. Thank you,
Thanks.
Bill. That was great. I think, well, just so for everybody's information, we'll let the three parts of the presentation go forward. And so draft some questions if you have them. You can put them in the chat or hold them and we'll get to those at the end. So we'll transition over to Bert.
Okay, so let me share my screen. And, I guess what I would say is that the primary point of this data integration, before I jump into the presentation, is that a lot of agencies and organizations tend to view those that they work with from a particular perspective or a particular lens. And sometimes they're missing other parts of that person's life. And so the real point of data integration is you get to understand the complexity of not only their agency involvements, but many different needs, some of which may not be addressed by the particular organization that you work for. And that's kind of the notion. You get a more holistic viewpoint. So let me share my screen. Can you see that? Yeah, we're good. Okay. So lots of people contributed to this at Beacon, but also these are all the different state agencies that participated in the project and that either provided data or were partners in other ways. So it was pretty comprehensive. And these are the different things. I'll give you a little bit of background, some of which Bill already touched on, how we did our data integration, what the demographics look like, what the interagency involvements look like, and then get into some of the high need indicators, both agency specific and cross agency, and then speak a little bit about cluster analysis. So, you know what? I'm sharing the wrong presentation. This is the long version. Let me go back and stop share. I had these both up this morning so I could make some edits, and now I'm sharing the wrong one. So here we go.
Just a reminder to folks to sign in and say hello from who you are. And thank you, Bert.
Yes. So as Bill was saying, the whole purpose was to better serve multi-system involved high-need individuals who experience homelessness by providing a trauma-informed, strength-based, person-centered approach to service delivery. And the reason that homelessness was focused on, and really the two primary data sets that we matched first were Medicaid and the homeless management system. And then to that cohort, we matched all the other state agencies. And so our goals were to conduct this match, identify the multi-system involved individuals, explore the patterns of what they look like in terms of multi-agency involvement, identify the high need individuals from each state agency, look at it across agency. And then again, as Bill mentioned, the purpose was originally to evaluate a cross-agency service coordination pilot. And because of COVID, things shifted. And so instead of the focus on the service coordination pilot, which we're still doing some additional work on, which Manisha and Fred will speak about a little bit later. But for this particular component that we did in 2019, we focused more on doing more advanced data analysis. It shifted to a coordination review and policy practice review. How do different agencies work together currently and how can we improve that? And then finally, we're working on a cross-agency cost analysis so that we can apply some data with regards to what does it cost to serve these highest need individuals. So I'm not going to spend a lot of time on this, but Bill mentioned that we matched by name, but we actually use 6 different levels because sometimes names get misspelled or entered differently across different organizations, or multiple people can have the same name, but we use this probabilistic matching process with 6 different variables, and we took all these different agency data sets that they provided to us and integrated them into one single sample. And in that sample, we had 10,420 people. 7,329 were identified as individuals. And the way that we identified, this is a whole other topic, which I don't have enough time to go into, but we had to distinguish between who was a member of a family and who was an individual. And what we had in this case was a family indicator that the HMAS system had. Most of the other agencies did not have a family indicator showing family relationships. And we'll talk a little bit more about that later. But there were 7,329 individuals, people who sheltered alone without any family members. There were 3,091 family members, including children and adults, that shared a common family indicator. Of that, there were 1,042 families, and those were adults and children that sheltered together. So there were about 3 individuals per family, 1 parent, typically a mom, and 2 children. In terms of agency involvements, knowing where individuals are overlapping in service utilization can really help inform policy practice or interventions aimed at creating efficiencies within the service delivery system and better serving the members that we have. So the average agency involvement, so the total number possible was 6, since we had 6 agencies, the average was 4.1. And nearly 55% of that sample had 5 or 6 agency involvements. So 32% had 5 involvements and 22 had 6. So, that's huge. And we did not expect to see that amount of overlap between these 6 entities. The organizations that had the highest levels of involvement were JVCSSD at 66% of the sample, DOC at 62, and DEMIS at 61. When we looked at family members, we saw a different set of results. It was average of 3.1 agency involvements. The majority had 2, and they were most likely to be involved with DCF and to be younger people of color. So there were different demographics depending on whether you were an individual or a family member. Key takeaways are that interagency involvements are the norm and higher than initially anticipated. Individuals and families show distinct differences, and large numbers, almost 4,000 individuals of this sample of 10,000, or more than 4,000, had 5 or 6 agency involvements. So it's very high. So when we looked at cross-agency high need, so as Bill said, each agency defined their own indicator of who's high need or high utilization within their organization. And we looked at it also across. And so what we did is we computed agency involvement, which agencies were you involved with. We also computed agency specific high need. And then we looked at individuals who were had 5+ agency involvements and 2+ agency specific high need statuses. And those became our sort of cross-agency high need. They were involved with multiple agencies and they were high need within at least 2 of those agencies. That was about almost 8% of the sample, 806 people, 737 individuals, and 69 family members. In terms of the demographics, when we looked at this high need cohort in comparison to the rest of the sample, they tended to be older, average age of 41 versus 36, male, 74% in this high need cohort versus 60% in the entire sample, white, and non-Hispanic. In terms of utilization, this group had spent, interestingly, fewer days in shelter, but more shelter episodes. And so this seemed to indicate that, there are a lot of individuals who go into a shelter once and may stay for an extended period of time. But there is a separate group of people who may go in for shorter periods of time, but keep coming back and have multiple episodes, since typically most individuals or families that go to a shelter go there once and don't come back. Over 95% of this high need sample had a behavioral health diagnosis. And I think that's very significant. Behavioral health is really extremely common. Almost everyone in the sample had a behavioral health involvement and diagnosis. We saw higher ED, inpatient, and nursing home visits in this group, and higher numbers of arrests, violations of probation, and incarcerations. We also did something that was called a cluster analysis, and it's a statistical method of identifying related subgroups within a cohort of individuals. So out of this sample, we wanted to look at, are there different subtypes? And so it's not one size fits all. Not all high need individuals are the same, but there are meaningful subtypes that could help us to better serve this population, to improve policy, services, and coordination. And it's really the point that they're not all alike, even though they fall into this high need work group or group. We entered 8 variables. The sample was 5,500 individuals. It yielded 6 distinct clusters or subtypes. And the cluster analysis, the R squared for that, just for any of you statistics folks, accounted for almost 70% of the observed variance in various utilization metrics. So it was meaningful. It really was highly related to how people use services depending on which cluster you were in. And just, I'm not going to go through them all or in a lot of detail, but just to give you a little bit of flavor, I just picked clusters 3 and 4. Cluster 3 had some of the highest rates of interagency involvement. They had higher than average rates of service use and events, incarcerations, removals from a DCF, child welfare perspective. They tended to have high need status across all agencies. And 36% was high need with HMIS, 100% had a behavioral health diagnosis, and they were 4.8 times more likely to be a high user of shelter days than the reference group, which was the rest of the sample. For cluster 4 of 718 people in this particular cluster, they had 0% having a behavioral health diagnosis. So this was very different from the rest of the cluster. It had a disproportionate number of Black non-Hispanic people, roughly 50%, almost no people with Medicaid or DEMIS high need, and lowest in terms of overall service utilization. They were the highest group, though, for DCF removal episodes, and they were about 2.8 times more likely to be a high user of shelter days than the reference group. So you see that these are quite distinct groups of individuals, and it suggests we may need to approach serving them differently. So some of the key results are that there were very high levels of interagency involvement, and that's clearly the norm and even higher than what was generally understood and expected when we started the project. The patterns of agency involvement, high need and service utilization differ greatly for families versus individuals. Demographics varied significantly across the cohorts based on agency involvement, rates of utilization, and high need. And again, this supports the further inquiry into questions regarding health equity and disparity. The cross-agency high need cohort was primarily white, non-Hispanic males with higher rates of shelter episodes, ED visits, hospitalizations, arrests, and incarcerations, and nearly all had a behavioral health diagnosis. And the cluster analysis provided measurable and meaningful subgroups of high need individuals that would be useful in further efforts to evaluate policy, practice, care management strategies, et cetera. And then there's some key lessons learned, which I think ties into the next presentation that we'll hear about, which is that data integration and this type of project is very doable and extremely valuable when there is a shared vision, commitment, and leadership. Without that shared vision and commitment and leadership, it's very difficult to pull it off. The proof of concept was successful, but there are many lessons learned that could inform future efforts, including what this group is going to be working on. So one of the key ones is that obtaining agreements across agencies with different regulations, applicable statutes, data standards, and primary purpose or mission is complex and can be arduous without a streamlined infrastructure. I won't identify who, but I'm currently, it's still in relation to that project, trying to negotiate a new data agreement between agencies and sharing, and it's taken over 6 months. So this can be very difficult if you don't have sort of the path and some infrastructure in terms of common forms and so forth worked out ahead of time. At least some agencies may lack established secure data file transfer processes necessary for secure transfer of data. This was really important because there were some cases where we had to come up with these workarounds to make sure that the data could be transferred in a safe process so that it couldn't be intercepted and used for other purposes. Demographics typically may not be consistently reported across agencies. I think HMIS was the only system that we found that had anything other than male, female, gender. They had an other category. And the way that race and ethnicity and other components are collected is not all the same. And you need those things to align if you're going to make comparisons or create an integrated data set. Other things regarding standardized data formats, the content, the format, the parameters are critical in terms of being able to match these things together and have the resulting data set make sense. So that's really important. And family indicators. As I mentioned, HMIS was the only system that we were able to obtain a family indicator on that showed family relations. And it's really important because the intergenerational effects of incarceration or DCF involvement or things of that sort are really important. And we need to be able to better understand that and also better serve individuals when they are members of families. And that's it.
Great. Thank you, Bert. What I will just say as we transition to the next presentation, so keep that in mind, and just a couple of comments about, one is the point of intersect where you're at, the notion that you might be able to do combination intervention across state departments, maybe from a care coordination like perspective by cluster. And well, the other thing that was really amazing is how manageable the size of those samples are. So there's a few hundred individuals in each of those groups, but probably very manageable and probably has the potential to huge quality of life improvements with the right multiple sector overview of those. So so I just make that comment on that project, but also leave for the group to consider this would be an ideal kind of consideration for the 12 state departments who are working with kids and families. And then the last comment I'll say is a couple things for us to think about as a group. Do we want to make recommendation about inclusiveness of a family indicator, since that would be potentially an opportunity to start to get state departments aligned with? And also, Bert, your last comments on maybe a template or structured template for all state departments to collect demographics. Those would be a couple of things that maybe our group can suggest or think about. So let's transition now to the folks from OPM. We'll turn it over to Scott, Fred, and Manisha and see who wants to take it away, but appreciate the work that Bill and Bert did, and then we'll come back for a conversation.
I think Fred, Manisha, I think I'm sharing, so just tell me when you want me to click.
Okay, I'm fine. Hello, everyone. My name's Fred Moore, and I'm a program manager with DEMAS, and I'm the co-chair of the services committee for 500 Familiar Faces. And we're just going to give, I'm going to give a brief overview of the history of how this evolved. Manisha is going to talk about, she is my co-chair as the service committee as well. And she's going to talk a little bit about what we're finding in terms with our interviews and our information gathering with the different state agencies and the ASOs as well. So Scott, maybe I think it's the next one I think we're on the next one. There we go. Okay, so basically a little bit of a background to this. Concurrently with the data match, we pulled together a group of service providers and developed and established a service delivery component or a pilot to this. So we're going to identify the folks that are overlapping and using multiple services across state agencies. we decided to focus on Fairfield County, and we were going to identify those individuals and conduct some sort of service pilot. Prior to COVID, we started thinking a little bit about the need for discovering and finding out what actually happens already. So how do these agencies integrate? How do they work together with shared clients? I think there was a perception by some that there was no coordination. So we wanted to kind of like start to think about that too. And then COVID hit and we realized that we couldn't actually really do a service pilot. So we switched over to thinking about how are we going to gather data to figure out how does DCF and DEMIS work together? How does JBCSSD and DEMIS, or DOC and JBCSSD, and all these other providers and state agencies. So how do they do this? So we worked and we developed a data collection tool. We use that as a guide now when we do our interviews, and we kind of like listen, and we develop more of a conversation with folks from the different agencies. So so it was paused due to COVID-19, and then converted to a coordination review. And now I will turn it over to my my wonderful colleague and co-chair Manisha to talk a little bit about what we found and what we're seeing as a part of these interviews.
Thank you, Fred. Good morning, everyone. So we've now been working with state agencies, interviewing what we're calling the key informants or program managers, and we'll be meeting actually with Bert, with the ASOs as well. So Bert, we have our meeting scheduled for today. And what we're doing is we're focusing on how do agencies currently coordinate services. So, and this could be coordination where you're serving the same client at the same time. Or it could be where a warm handoff, right? So where, as an example, where DCF youth are growing, and then as they transition out, they might transition to DEMIS services. So just understanding the current processes. And our goal is to highlight best practices, or at least, what we feel are best practices that are, innovative ideas that perhaps can be expanded within the agency, with other agencies can perhaps join on as well. So for example, some of the things we've been learning is DEMIS has a no wrong door approach when somebody enters into a regional area. DOC, I think something that maybe this group also might want to think about is DOC has a ranking system for every inmate. They rank them on a scale of 1 to 5 for mental health, as well as behavioral, as well as actual physical health. And based on if they rank high, 3 or higher, 4 or higher, then they're before being released, the DOC works very closely with other agencies to coordinate those services so that these folks that need additional services have them set up and ready to go upon release. And so that ranking system, we thought, is a really interesting idea. It ties in, I think, really nicely with this 500 familiar faces work that we've been doing, about the identification of the high need users, utilizers across the various agencies. So something for, I think, agencies to think about. So I'm not going to give it all away. You got to read our report. It's hopefully going to be out in a month or two. I do want to say that it's, for me personally, it's been a great process. You always hear that agencies are siloed. And just learning about all the coordination that is happening, it's been really a lot of good work going on. We're really happy and excited to be able to highlight it. And Fred, somebody said this to you the other day, which I thought was so insightful, that agencies aren't siloed. It's the data that is, agency data is siloed. So with that thought, I'm going to now kick it over to our Chief Data Officer to talk about how we're going to take care of those data silos. So Scott.
That's great. So tall order. So I think this is hopefully I think a good sort of continuous presentation showing this is a really innovative pilot, sharing data across agencies to demonstrate that it can be done, making the connection to the service delivery to really emphasize that the reason for sharing data is not to share data for data's sake, it's to improve the delivery of services and outcomes for the residents of Connecticut. And so kind of building on this framework, one thing we're trying to do is look at ways that we can, remove or, minimize the impact of the silos that are there for sharing data, so that when people need to share data across agencies, there's a more coordinated and streamlined process that's in place. So I'll talk a little bit about this. Some of this I think is a refresher from the discussion in the last meeting, but I know some of this is maybe new terrain for the group participants. So I'll reiterate a couple things and then just go through trying to match some of the things that are lessons learned from that the 500 familiar faces pilot and how we're again attempting to address those. The one thing I'll emphasize is the work that Bert described, that everyone involved in this effort has been undertaking for the last year or so is remarkable and exceptional for Connecticut, but it is not remarkable or exceptional nationally. This is the kind of thing that is done all over the country in different states and jurisdictions. And so we pulled a list of other examples of integrated data systems of different sorts from different parts of the country that pull together different kinds of data on children's behavioral health. And so you can see, like, this is an incomplete list. We just picked a few that are more comprehensive or sort of compelling examples. But this kind of thing is done, all around the country. And what we want to do is make it so that this is something that is a normal rather than an exceptional process in Connecticut. And to do that, it takes a specialized, sort of set of skills, a specialized set of tools, policies, and procedures. And so that's what we're in the midst of developing, and I'll kind of talk through some of those elements. But again, the work that's done here, I think, is exceptional and notable for Connecticut, but it is something other parts of the country do, and we can talk to and learn from those sites to kind of hear more about the approach that they're taking. I'll emphasize just another point, and Tim had made this in some of the preparation for this meeting. It's also something the state needs to do because it will help us be, not only improve outcomes for individuals, but it'll help the state sort of operate more efficiently. That when we can remove silos between government agencies, that helps the state. The state took a, I think, close look at government efficiency earlier this year, issued a report to the governor at the end of March on government efficiency, particularly around the quote unquote retirement cliff, where there's a lot of state employees potentially retiring in a year or so. One of the areas they identified in the report as an area for improvement on efficiency of government is on sharing data across different agencies. And so that's where the system that we're sort of in the midst of expanding and further developing, which is called P20Win, was cited several times as an opportunity for the state to sort of take on more in this area and increase the efficiency of government. So it's not only, I think, a way to improve service delivery outcomes for individuals, it's a way that government can be a little more efficient. The name of the report is on the slide. It's the CREATES report, which is a complicated acronym, has something to do with cliff retirements, et cetera. But there's a link to it that's in the slides, and we can send it afterwards. But it's just emphasizing that there are multiple reasons that the state needs to kind of get better at sharing and moving data across agency silos. And so that is what we are trying to do, and we're very happy to have the discussion with this group about how we can do that in a way that takes into account the work that you're doing. I will talk. This is the refresher portion, and I apologize if this is truly redundant for folks, but just in case you did not retain every word of the presentation last time. Like I said a minute ago, we're trying to develop a system that's similar to what other states have. We're building on infrastructure that's been in place for several years for the state's longitudinal data system. It's called P20Win. The name reflects the evolution of the system and it's based in kind of education or workforce, where they're looking at kind of cradle to career outcomes, from early childhood into K-12 system, into higher ed, out into the workforce. So the system has been, in place and in operation for a few years, and just in the last year, it's really started to expand into the health and human services world, which would give us that sort of comprehensive system that some of the other states and jurisdictions have. So P20Win is the name. The vision is what you see here. This is kind of a vision that's agreed to by the board, and can be updated occasionally. And again, like we talked about, I think last time, essentially the way it functions inside the system, it takes sort of a specialized set of skills, policies, and procedures to make these kinds of things work. But it is, not something that we have to invent. It's something that we can learn from other places about. Kind of from the outside, I think the way most participants in this group would approach it is how it works to kind of get data out of the system. And so in that case, you develop a request, you formulate, here's what I want the data for, here's how I'm planning to use the data, here's the purpose for it, here's who's going to be handling the data, more details on exactly the kind of data that you need. The agencies that are part of the system, who are the stewards of that data, review the request. If everybody approves, they sign sort of the relevant forms for it, and I'll talk through some of that in a minute and how we're trying to address some of the challenges that Bert described and is continuing to face. Then we integrate and match the data at our Department of Labor. They've got sort of a secure way to link and match data across agencies. They have a lot of experience doing this, so everybody sends the data to a central hub where it gets linked together, and then after that process, the person who made the request for the data, assuming they've gone through all the steps of this, they receive the approved matched data, which they again agree to destroy, after a certain period of time. But it's not data on individuals sort of living in perpetuity outside the state system. So essentially, the person who would like the data formulates the request and says really what they're planning to use it for, how they're, what data they need. The agencies review the request. The data gets matched and linked, produce a data set. So there's more to it than that, but from the outside, that's basically the way kind of the system does and should work. I'm going to emphasize one point, and I'll talk about this a little more in a second too. All of this is public information, so there's a website link here. P21 website it's part of the OPM website. We have all of the agreements that are part of the system are public documents. All of the requests are public documents. The meetings are public meetings. And so this isn't something that's happening kind of behind closed doors. This is something where we're attempting to be as transparent as possible about the nature of the request process, how these decisions are made and reviewed. And so I think it's not, again, something where everybody is or wants to be in the weeds of it, but I will just emphasize that it's something where we value transparency, and I think the more transparent we are about how the system works, the easier it is for people to use it and to understand how the data that's collected on our state's residents is put to use. And so everything that you're seeing here is documented or is public or part of sort of public meetings, and we can talk about the details later as you wish. I'll click to the next slide. There's a governance framework. There's a very careful process for decision making about the system. There's an executive board, the commissioner leadership for the agencies that are part of the system, a data governing board that sort of sets the policy for how requests are managed or reviews the request, makes decisions on individual requests, and then the data stewards, the people that are close to the data within each individual agency. And then the agencies that are part of it, again, reflect this sort of cradle to career and the expansion into health and human services. And so it's, for the acronyms, it's early childhood, the state K-12 system, our higher ed system, UConn, state colleges and universities, the independent colleges, Office of Higher Education, Department of Labor, and very soon, possibly today, the Department of Children and Families, Department of Social Services, Coalition to End Homelessness. We are actively reaching out to other agencies to kind of continue to expand the base of this. But the agencies are involved in the governance process. They make the decisions about their data. So to Tim's point about onboarding new agencies, it's not something where you're giving data over to somebody else. You are the stewards of it, and you're ones making decisions about kind of how it's used. That's the governance framework that is inherent really in all of these integrated data systems, and so that's what we are building on here. I'm a little cognizant that I think I'm over time a little bit, but if folks want to go into kind of like how the actual transmittal of data works, this is an example. And again, this is in a public document that you can read if you want to go into the nuts and bolts of it, but it talks about how the data is pulled from agency systems, sent to a central integration hub at the Department of Labor, matched, and then the data is sent back to the requesters. This is an example of a request that was from researchers at Yale to evaluate the impact of pre-K programs. And so the movement of data is complex. This is some of the things that Bert alluded to, but there is a sort of standard policies and procedures that are in place, and that we're kind of actively revising to hopefully make sure that it addresses the questions that are raised. We have a research agenda. I'm just going to skip this also. And then we get one thing before going into the lessons learned from Bert. So I think to emphasize the point on transparency, with the continued evolution of P21, the expansion into health and human services, really trying to emphasize that it is a system that people can and should understand how it works. They should know what happens with their data. We all, well, if we're Connecticut residents, we all are giving data to the state one way or the other. Every time you fill out a form, it's going probably somewhere in the state. And so people should understand how that data is used. So as part of the sort of changes for the system, we are developing a plan for a resident advisory board. The sort of scope of this is described here, but it's a way to have sort of community voice and input in the process for how P21 works, which has not been the case, which is why we're developing a plan for it. And that's something that the executive board endorsed at the last meeting. We'll have a report out with the executive board at the upcoming meeting in August. And if there's, I know particularly for this group, that there's probably folks who have experience working on these kinds of things, sort of having, you know, consumer oversight or consumer advisory groups. So if there's anybody that has input on this, we're again sort of actively developing a plan for putting this in place for P21, and getting insights into this will be very valuable. I can give you the sort of contact information after this to help us out on that. All right. So Bert raised some challenges, opportunities for the integration of data, and I'll kind of talk again, hopefully at a fairly high level about the way in which we're attempting to address these. But that's you know, all of these are kind of a lengthier discussion, and if folks want to go into detail, then we can do that at any time. So I think one central point for 500 Familiar Faces is importance of leadership. That's something where that governance structure that you saw, we're really trying to make sure that there's, you know, regular, consistent meetings for the agency leadership that are part of P21, that they're engaged, that these are all, again, you know, meetings that are open to the public, so folks know kind of what's happening, and you can see the agencies are actively part of this process, that they're not, you know, that they're central to it. I think possibly the main lesson learned from 500 Familiar Faces is that the process of the legal agreements can be arduous. I think the timelines that Bert talked through, it's months to complete these agreements in many cases, but the actual, you know, the matching and the analysis is a much faster process. And so the real challenges to data sharing are on this legal agreements front. The law is not a barrier. You know, we cannot get around the law. The law is what it is, but what we want to do is try and make it easier for people to understand what the law says, what it does and does not say, and to provide consistency and sort of templates for the way data sharing agreements are developed and executed across the agencies. So we have a framework that was kind of approved and endorsed by OPM leadership and by the Attorney General last year. We are developing enterprise agreements that are based on that framework that we are hopefully executing this week to add on the new agencies, and then developing templates for data sharing so that there's an easier, more consistent process for each of the different sort of legal frameworks that's in play for the agency. So, you know, we generally cannot change the law or get around the law, but if you understand the law, then I think what we want to do is provide a way that that can be navigated, and, you know, everybody kind of gets the same treatment in that process. And so that's the main, I think, emphasis we had in the expansion of P21 is really looking at the framework for the legal agreement. Some of the points on technology, I think, again, there's inconsistent tools used by a wide range of agencies. And so something that comes as part and parcel of a system like P21 that is kind of an enterprise system is that we have standard tools and procedures that agencies are expected to adhere to when they are part of that system. We have a technical upgrade planning process that is concluding now, basically to look at recommendations for increased consistency in the tools that agencies use and to improve the sort of security and the quality of those tools. And so again, when you have sort of everybody doing things on their own, that's when you get inconsistent technology. When we have more agencies that are part of a single system, then we can see standardization. I think the same applies to some extent for the demographic data. This is a meaty challenge to wade into, but we start by providing documentation, standard procedures for how the data is sent and transmitted across agencies, the format of the data. Something that's worth future, I think, discussion is that one of the changes this legislative session is really going to change the standards for reporting race, ethnicity, and language for agencies that provide health or health-related services. That's through Public Act 21-35. And so those changes will start to occur in the next several months. And I think that's an area where you'll start to see kind of in a top-down way, more consistent demographic data. But when that's not the case, which I think will be likely in some scenarios, then providing transparency on the documentation, how the matching is done so that there's, sort of the precedence for different categories. That's an area that we're.
Scott, can I hit the pause button?
Yeah.
This is Jeff. We had a question from Bert. I think you may be getting to it, and I think you did talk a little bit about it last month. But Bert's question gets to, at this point, the capacity of P20Win is to respond to these sort of point in time requests that come from somebody. And his question has to do with whether there's a plan to develop capacity for like an ongoing feed of information, or maybe a dashboard that's reporting consistently out on some common questions that come up. Can you talk a little bit about building that capacity over time?
Yeah, so this is, I think this came up last time. I'm sorry, I can't see the chat easily when I'm looking at the slides, but I think this came up a little bit last time. I think it depends on what you mean by ongoing feed of it, or, so if there's something where there's a dashboard or there's regular reporting, that's something that P21 already does. So there are not lots of, but there's a handful of requests that are for sort of repeat annual or regulatory reporting or something like that. So that is the case, today, and can be the case in the future. I think if it's something where, the request process, it's a one-time request for regular reporting. Maybe that's sort of how I would put it. So you're making a request that says, I want to feed every month or every week or every, quarter of these key indicators. And so that's the way it does operate. And at least in my opinion, like those are consistent with one another. It's making a request that says, I want this feed, on an ongoing basis. I don't know, for the next 5 years, every quarter, I want these indicators sent to, the organization. So you have to make the request kind of once up front, but then you can say you want it on an ongoing basis. I think then, and again, like there's a sort of the probably most prominent kind of report that P21 produces is what's anecdotally called the legislative report card, but it's a report on outcomes from post-secondary and workforce training programs. And that's something that's produced kind of every year for the legislature. And that's an example of something that's just an ongoing request. And the agencies that are part of that, they refresh it every few years and they say, our indicators changed. And so that's something they could do. So this group, for example, through the behavioral health plan leadership could say, these are the indicators we want to, monitor the effectiveness of the children's behavioral health system and make her, you're not in a position, I think, to do this, but you could make the request, today, basically, and say, we want these indicators on a frequent basis over the next, fixed period of time. Like that, the system is built to handle that. I think if there's like a daily, feed of information, we're not built for that yet, but like the real-time integration, I think what Tim described as the gold standard in the last meeting, like that, we're not there yet. But if it's, for reporting, dashboarding, something that's like weekly or monthly or quarterly or semi-annual or annual, like those are all viable options. Weekly is going to push the boundaries of the system capacity, but monthly, quarterly seems reasonable.
Okay, that's very helpful. Thank you.
Where did I stop rambling? Standardized data formats. This is, again, when agencies are doing things on a one-off basis, you have inconsistency. And so having agencies be part of a single system, we can sort of require standards as part of that. There's a data governance manual that we are in the midst of revising that describes the standards that agencies, I think, are held to for transmitting data to the data integration hub. We have regular coordination with the data stewards across all these agencies. So there's a sort of like a set of meetings to develop both standards, but also the culture that goes with just kind of working together on things and modifying that over time. So I think that's where, again, the 500 familiar faces is challenging because you have to go one by one agencies. But if we have a system, then you'll see more consistency. Family indicators is worth its own separate working group. This is the most complex topic here. I think I would just say maybe two things before I chew up too much of the time. This is something, progress is possible. So there's other projects and efforts in the state that are looking at this. 2Gen Advisory Board that, I think has a clear focus on sort of families, households, intergenerational by its nature. There's an ACES project that I know some of the agencies are involved in that's looking at this. The challenge on this front is that it is not, as I interpret it, sort of any single entity's job to do this or to produce this. There's nobody whose role it is, and so when things don't have a clear responsibility, they don't get done. And so this is something where it's sort of part of or at the periphery of a range of projects, and so it sort of is getting addressed in bits and pieces, but not kind of holistically. It is challenging. There are other states and internationally. I think people have done this. There's good literature on this that I know some of us have been part of some good side discussions on this topic. It's challenging, particularly as you get into places with like very complicated or complex household structure, where you have high degree of mobility, intergenerational households, like that's beyond the sort of multi-generational household. So it's not easy. I come from I'm in a nuclear family. We have a husband, wife, 2 kids. Like we're pretty easy to model, but when you start to get into more complex household structures, it pushes the boundaries of what the state administrative data can do. But we can look at examples from other places, and I think that they're instructive as to when either there's over or under identification of families, and so it's a worthwhile endeavor that again has just not been the center of any initiative, but I think it's a good opportunity to think of where that could occur.
Scott, I'm going to ask a couple more. You noted that you were having a hard time seeing the chat, so there's a couple more questions, and we've got about 7 or 8 minutes left. So let's address a couple of questions, and then I know Tim wanted to take a minute at the end to propose a formal recommendation from this group. So first of all, from Julianne at CJR, what roles do organizations that have contracts with state agencies play in this process?
Oh, that's a good question. So I'm trying to read the chat. You're essentially a contractor to the agency. So it's really the agency, whoever is the steward of the data. The threshold question for participation in P21 is who has the authority to share the data. And so whoever has that authority to share the data with another entity is kind of the one that joins it. So I think in most cases, it would be the agency would be part of it, and the contractor would be sort of the subcontractor to it. There's provisions in the legal agreements because we know that agencies work with contractors, subcontractors. My guess is that you might be asking a question that you have like a more specific question about, which I welcome you to ask. But that's essentially the real question is like who has the authority to share this data with other places, and I think that's the way the system is organized.
Great, thank you for that. And the other question from Kathy was noting a couple of challenges that we've talked a little bit about, that agencies use the same demographic and family indicators. And I'm curious about that one too. I see that you've noted a couple of potential approaches for standardizing demographic data and also incorporating family indicators, but can you tell us a little bit more about addressing that particular challenge, like kind of getting to the family level?
Yeah, I think there's 2 related but separate challenges here. One is on the demographics, where like we are in a position that agencies use different demographic categories. And until there's increased standardization, there will be challenges. The way to address that challenge is to try and crosswalk them to the extent possible. And if you can't crosswalk them well, at least you can document how you're doing that. And again, I think that's where the transparency is important to say, let's say there's different categories for gender across 2 agencies. If you short of changing the way data is collected from the end participants, in the immediate term, all you can do is crosswalk them and say, like, here's how we're going to choose these categories from that. Otherwise, you have to go back out and sort of, change the standards for the agency, go back out and collect the data and so on. So I think in the immediate term, we're trying to crosswalk and provide transparency about the decisions that are made. Most of those decisions are going to be imperfect because agencies don't have the same sets of categories for how they collect data. But that legislation is going to encourage standardization. I think through participating in a system, you'll see more standardization. Family indicators, again, really challenging. I think as Bert may have mentioned, I know he's mentioned that in other cases, the a lot of agencies don't collect, or programs, I shouldn't say agencies, programs don't collect whether someone's in a household. So if it's not collected, it's very hard to analyze it after the fact. I think you can sort of back into that using some other information that's collected. There's an effort in California where they use the address to try and unify records, but even that's imperfect because you have multifamily, residences where it's just hard to track that kind of thing. So,
I'm sorry to interject. If you could take yourself off of screen share, Scott, with the few minutes that we have left, I think that would help us get to the last couple of questions. Julianne did follow up, and I think I'm wondering if perhaps the advisory board, I think you referred to it, or the community advisory board, I can't remember where you might be the place where providers could get involved if they want to share their expertise with the group around addressing some of the challenges on shared definitions and demographics, for example. Is that the place for a provider to go if they want to be part of this?
I think there's two avenues. It depends a little on the nature of the provider. So one would be through that group, which is yet to be formed, a resident advisory board. The second would be through the agency itself. So again, the agency designates people to be part of the governance process for this. And so the contractors can and should communicate to the agency they're contracting with about that. I think it's the most direct connection.
Great.
Those are the two that I would see.
Great, thank you. And I just want to thank all the presenters for sharing this information. Very, very helpful. And I'm sorry to interject and keep things moving with the time we have left. I know there's so much to talk about, but I do want to turn it over to Tim to just talk a bit with us about putting together a recommendation from this group around P20 Tim?
Yeah, thank you. So we are trying really hard to be focused and concise around the 60 minutes. So at times it may feel like it's cutting things off, but we're really not intending that. So I guess at this point, we are 1/3, believe it or not, these two meetings that we've had through our tasks. So we have 4 meetings left. We'd like to kind of build a series of recommendations. This won't be the last time we'll have an opportunity to talk about this, but we want to, at this point, given that you all, a number of you were on both the last meeting and this one, we were 23 at our peak on this meeting, a little bit stronger at our first meeting. Is there any reason why anybody on the meeting does not feel we should put our support as a Children's Behavioral Health Implementation Advisory Board work group, our recommendation up to our leadership, 12 commissioners and our advisory board, for getting support behind the P20 win and using the infrastructure that is furthest along in the state of Connecticut? So that's really kind of the formal recommendation. So I know we're down to a minute, and again, I'm not trying to trap you into making the decision right now. We'll revisit this, but we want to kind of hear from anybody that's still maybe wondering if this is the best plan forward. Anybody want to say that this is not a good thing, or you're still unclear? Colleen, you came off mute. You want to make a statement?
Yeah, the only thing I want to say, Tim, is just I know that I think it's fabulous. I just know that there are statutory and federal guidelines around sharing of information, particularly around substance use. And so I think, Scott, you're the one who said, we understand the law, then but law can be navigated. So it's just something that we have to kind of pay attention to, is I think that a desire to participate and the ability to participate may be two different things, at least from the adult perspective right now. So I think that that's just something that we need to keep in mind, and as we kind of move this forward. From a children's perspective, I think this is like a slam dunk. From the adult perspective, I think we just have to, there are a few more hurdles or obstacles that we have to pay attention to.
Sure. And by the way, your comments is true across the board, as I think Bert referenced, I think everybody. And I think what these two projects demonstrated is that we can overcome those, and keeping both the confidentiality, the security of the data, all of the protections around that, both around individual privacy, confidentiality, as well as the overall security of data. So I think those are all good. So again, we won't prolong the meeting. We're 1 minute over at this point. I think we can say comfortably for the 20 or so folks on, we have a consensus about this. So we'll start to formulate this more formally. And so 1/3 of our meeting times are down. Just call your attention that our next meeting is August 25th, and the one after that is September 22nd. You guys are the champions. You hung in there the whole time, so we appreciate that. Feel free to bring folks along who are like-minded thinkers around data and data integration. And a huge thank you to all the presenters also. So thank you all for participating and have a great day.
Thanks, everyone. Take care.
Take care.